Hi, and welcome to Royal Freemasons Benevolent Institution. We know how important it is to remain independent and comfortable in your own home, and our Care at Home team are here to help you do just that for as long as possible. We understand that navigating aged care can feel overwhelming. You want the best outcome for yourself or for your loved one. But there's a lot to consider, and understanding how support at home is funded can be confusing. In this video, we'll walk you through the Support at Home program and government funding available to assist you in receiving the care and services you need to stay living comfortably at home. Before you can access government-funded aged care services, you'll need to be assessed and approved for these services. If you haven't started that process yet, you can request an assessment through the My Aged Care website. If you need assistance, our team can help you. Your assessment will determine if you are eligible for government-funded aged care services, and if so, you will be issued an approval notice indicating the services you have been approved to receive. Once approved, you still need to wait until you have been assigned funding before you can receive government-funded support at home services. Your approval will outline a summary of your aged care needs and goals. It will detail the services you have been approved to receive, the relevant service categories, and your assigned support at home classification levels for ongoing services. It will also include any approvals for short-term support and the associated funding amount provided for these services. There are 8 classification levels within the Support at Home program, each with an associated budget that you can use towards the cost of your ongoing services. The table provides an indicative budget for each classification level. A Class 1 classification reflects lower support needs and therefore a lower level of funding. As the classification level increases, so too does the level of support and corresponding funding. The amount you will be required to pay for your support at home services is determined by the government, based on the type of care and services you are receiving and your financial situation. All services are allocated to one of 3 categories: clinical care services, supporting independence services, and everyday living services. The government will fund all of your clinical care. However, you will be required to contribute towards the cost of your non-clinical care services. For services that fall within the support independence category, you will be required to contribute between 5 and 50% of the service price. For services that fall within the everyday living category, you will be required to contribute between 17.5% and 80% of the service price. The government will advise you of the percentage you are required to contribute towards the cost of services in each of these categories. Service prices are set by the provider, and you can find information on RFBI's Care at Home pricing by contacting our Care at Home team. Once you have been assigned funding, your local RFBI Care at Home coordinator will work with you to create your personalised support at home plan. Your plan will be built around your care needs and your services that you have been approved to receive, your personal goals and your budget, and will regularly check in to make sure it still meets your needs as time goes on. In order to understand how much you will need to contribute towards your support at home, you will need a means assessment. The government will use your means assessment to determine your contribution rate for services. If you haven't yet completed your means assessment, we strongly recommend that you do. Even if you are a full pensioner, you will still need to complete the means assessment to confirm how much you are required to contribute towards the cost of your non-clinical care services. As we mentioned earlier, your aged care assessment will also identify if you are eligible to receive funding for short-term supports. Approval for these services is provided separate to your ongoing support at home services, with associated funding provided in addition to your classification level funding. There are 3 short-term supports that you can receive through the Support at Home program. These are home modifications and assistive technologies, restorative care, and end-of-life care. Like with your ongoing support at home services, you will need to be approved. Then wait for funding to be assigned before you can receive short-term support services. Let's go through each of these in more detail. Approval for home modifications and assistive technologies provides funding for you to make changes to your home such as making the entry more accessible or adding the grab rails so as to prevent a fall. It also includes the purchase of assistive technologies such as emergency response devices and fall detection systems that help you remain living safely at home. Funding can be used to cover the cost of the prescription item, delivery and installation or fitting. As these services fall under the everyday living category, you will be required to contribute towards the cost of these services, and the government will advise what percentage you are to contribute based on your financial situation. Now, let's talk about restorative care. Restorative care allows you to access up to 12 weeks of allied healthcare and services. For all support-at-home services, including restorative care that falls under the independence or everyday living categories, you may be required to contribute to the cost of your care and services. You can also be approved and funded to receive end-of-life care. Individuals with 3 months or less to live will be eligible to receive funding to receive 12 weeks of end-of-life care. Consistent with the Support at Home program, your contribution will depend on which service category your care falls under. At RFBI, we believe that your independence is key, and you should always feel in control of the services you receive. If you would like to know more about the Support at Home program or the care and services you receive through this program, please reach out to our team. We're here to help you every step of the way.